Hi, I'm Dr. Chris Bartlett. I'm the Medical Director at the Memorial Health Systems Mary Lou Bashir's Breast Care Center. And I'm here to talk to you about breast cancer and some of the risk factors.
Well, tell us a little about risk factors, what women have to worry about as they're getting near 40, whatever it may be.
Well, breast cancer is pretty complicated. Some breast cancers can present as something you can feel. We like to find breast cancers before you can feel them. That's the whole idea of doing a mammogram. Very uncommon to have breast cancers in your early 20s. We start to see a little bit of an increase in the number of breast cancers in the late 20s, particularly in patients who have a real strong family history of breast cancers. But most of the time we start to screen for breast cancers in about the mid-30s or early 40s. So the kinds of things that a woman needs to do to find a breast cancer would be to do a clinical exam or have her physician do a clinical exam at least once a year. And what are we looking for? We're looking for something that is changing. We're looking for something that's non-palpable, a thickening or an actual hard mass in the breast. Sometimes breast cancers will present as discharge, usually bloody discharge, occasionally a clear discharge. But any change in the breast may potentially be a sign of an early breast cancer. So if you have some change and you have regular doctor's visits, or even if it's not a regular doctor visit, bring it to the attention of your physician or nurse practitioner. As far as screening goes, typical in the United States, we usually start screening in the low risk setting. That means someone who doesn't have a family history of breast cancer. The American Cancer Society recommends that we start at age 40. If you've got a family risk of breast cancer, usually we ask that you start your first screen at age 35. And it depends on your physician's preferences. If you have a family history, they may start you even earlier. It may be that your mother had breast cancer when she was 32. So maybe may make more sense to start screening even earlier than that, or screening with something that's more sensitive, like breast MRI. So in breast cancer today, we have a lot of different tools that we didn't have 10 or 15 years ago. You know, the frontline tools are clinical breast exam that you do on yourself once a month, and very important that you know how to do a clinical breast examination. It's evolving, and the way we teach how to do breast self-examination has changed quite a lot over the last few years. Peggy Thomas, our breast health nurse here at the Memorial Breast Center, is a certified national teacher, teaches other breast professionals how to do clinical breast exams. She's available if somebody feels like they haven't been taught how to do a breast exam and would like to learn how to do it better. She can also teach nurse practitioners and doctors how to do a really high quality breast exam. So that's number one. Number two is a clinical exam done by your medical provider once a year. You absolutely need that done after, let's say, age 20. If your physician or nurse practitioner aren't doing a clinical exam, you need to ask for one. I mean, that should be part of your everyday, once a year, care. And thirdly, again, that third part of the three-legged stool is a mammogram. Is a mammogram going to find every breast cancer? No, it's not. If you have really dense breast tissue and the cancer is very small, it may be obscured by the dense tissue. You may still be able to feel it. So you may find the breast cancer with a clinical exam. Ideally, we like to find breast cancers with mammograms before they're palpable. Only a mammogram can find breast cancers when they're really microscopic. And the way we do that is that some cancers, about 50% of cancers, will produce calcifications. And only the mammogram is going to be able to detect those calcifications. So only exam. Mammogram is the only way to find early microscopic breast cancers. We don't want to find breast cancers when they're palpable, but we certainly do want to find them. So if they're not visible on a mammogram and you can feel them, then an ultrasound is the next tool.